Whenever someone is planning a surgery such as a tummy tuck, it is natural to feel anxious. It is natural to feel whether you are going to have any adverse effects or side effects and whether there can be any complications after this surgery. So let me explain to you what are the known complications after a tummy tuck surgery. Sometimes a lot of questions or concerns that patients have are not even valid, and I am going to explain to you in this video how a proper management and a post-operative care can ensure that you don't have any complications after your tummy tuck surgery. So the first and foremost is the risk after anesthesia. So to minimize the risk during anesthesia or after anesthesia, it is important to be healthy. So by this it means that we check all your parameters, we check the functioning of all your vital organs and make sure that you are in a good condition in order to get anesthesia done for this surgery. You need to have proper maintenance of your blood pressure, of your blood sugar and your heart condition whenever you want to go for a surgery. The second risk can be infection. For preventing infection, of course, we take utmost care that there is no break in the sterility during your surgery, and post-surgery you are put on sterile dressings around the incision line and you are given antibiotics for a due course of time. And taking the proper medications in the properly advised manner will ensure that you don't have any risk. The third risk can be bleeding. Now to minimize bleeding, there are two drains which are kept under the skin when you are in the hospital, and when you go home you are given a compression belt to wear. The purpose of this compression belt is to ensure that there is no collection of blood between the skin and the muscle, so do wear the belt as advised. The next complication that can happen is a seroma formation. Seroma is collection of lymph fluid between the skin and the muscle. Again, as with bleeding, it is important to wear your compression garment properly. What happens is when you wear the compression garment, it ensures that there is no vacuum or space between the skin and the muscle, and as long as the skin remains snug with the underlying muscle, there is no space for fluid to accumulate, and seroma therefore can be minimized by wearing your compression garment 24/7 at least for 4 to 6 weeks. Asymmetry after a tummy tuck usually does not happen because very precise measurements are taken on each side before the skin is excised, and by proper attention to detail we ensure that there is no asymmetry in the final outcome. Some patients have a tendency for a poor wound healing. Sometimes their scars tend to thicken and that is called as scar hypertrophy. Some patients also have the tendency to form keloids, which are like thick elevations on the incision line. Both of these can be minimized by meticulous attention to detail when the wound is being closed, and then post-surgical recovery you are given silicone creams to use, you are given steroid creams to use, and we also prescribe something called as a silicone tape which ensures that you heal without any problems in your scarring. The next known complication is fat necrosis. So what happens is tummy tuck is normally combined with liposuction, and if too aggressive a liposuction is performed, then the fat globules can remain under the skin and then they come out in the form of viscous yellow fluid which is called as fat necrosis. If someone has fat necrosis, it is treatable by antibiotics and the use of a compression garment. One other concern that patients have is about formation of blood clots after this surgery. To minimize blood clots, there are two things that are done. After the surgery, immediately we put something called as a compression garment on the calf. So that compression pump ensures that there is no blood clot that forms in the calf veins. And secondly, in patients who have had a long flight or who are bedridden, we put them on injections of blood thinners which ensure that blood clots don't form. This is how most of the complications in a tummy tuck can be prevented by proper attention to detail. The one thing I would want to emphasize in this is you should always follow your post-operative instructions to the T and never miss your post-operative follow-ups with your plastic surgeon. And if you feel at any point of time that the swelling has increased or the recovery is not as has been expected, please get in touch with your surgeon immediately so that appropriate process can be initiated to get rid of this problem. If you have any other questions related to complications after a tummy tuck surgery, feel free to comment in the comment section. So don't forget to like, share and subscribe to our channel.